meeting of the Human Services Committee will now come to order. And before we begin the roll, I would just like to welcome the new legislators to the Human Services Committee, Legislators Boyce, Ansello, and Michike. So thank you for, and our returning legislators also to come to this committee. So.
Okay, Mr. Ansello. Miss Andrews. Miss Boyce. Mr. Daniele is excused. Miss Kaylee. Mr. Lightfoot. Mr. Michike. Dr. Quattro. Chairwoman Draw.
Here. Is there anyone signed up for public forum?
There is not.
Thank you. No one. Is there anyone present who's not signed up would like to speak? Okay. So at this time, the next item of the agenda is the approval of minutes. You have before you the November 29th, 2011 minutes. They will stand approved unless the clerk is notified of any changes before the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 12-19.
Moved by Legislator Boyce and second by Legislator Michike. Is there any discussion on this? Legislator Lightfoot.
Good evening. Just want to ask how many cases of tuberculosis do we typically have in our county each year? Through you, Madam Chairman, to the administration.
Through the chair, we approximately have 20 cases per year.
Thank you.
Any other discussion? Legislator Kalin.
I'm sorry. Thank you, Madam Chair. I left my questions in the other room, but let me see if I can remember a couple. You're saying, thank you, if I heard that it was 20 per year, or in the last. Thank you. Through the chair.
Through the chair, and for the benefit of the committee, I am Byron Kennedy, Deputy Director for the Health Department. In answer to your question, through the chair, that is per year.
And thank you. Through the chair, has that gone up or down significantly in the last?
Through the chair, this used to be about 30 or 40 per year, and that's what you would expect based upon maybe statewide, but also national averages, which is roughly about 4 to 5 cases per 100,000. So we actually do better than the national standards, and according to the state, through our efforts. Through the chair. Thank
you. And through the chair, could you explain, this is dealing with prevention, control, elimination, and screening. Could you just give me a brief explanation of the screening process? In other words, if I could rephrase that, how is the outreach handled? Through the chair.
Through the chair, typically one of the initial screening tests that occurs is a test called the PPD, which is a skin-based test. And generally when that test is done, we do that in our clinic, and it's also done in other community practices. And when there is a positive result from that skin test, then a subsequent chest x-ray is performed.
Thank you. I know that TB testing is done in children, but how would you connect with adults that may have contracted TB? Are we talking just early screening through the chair, or are we talking outreach for adults in the community, and how is that outreach? How do they come into service, in other words?
Through the chair, there are targeted efforts based upon the subpopulation that's deemed to be high risk. So, for example, that can include, migrant camp, that can include homeless shelters. In the case that tuberculosis is a notifiable disease, typically we will receive, cases, from other providers or from the hospital, simply because we are the contact point, for the county.
Thank you. And just one more, if you could be patient with me. Would you venture a guess as to how many, not that it's really important at this point, but through the chair, could you venture a guess as to how many cases of TB or active TB that we might actually be missing?
Through the chair, in the case of someone who has active TB, generally they have very pronounced and very specific symptoms. That can include like a cough, fever, chills, and so they will be on someone's radar, if not their primary care provider or someone else, who would be familiar with those symptoms. So I don't think we're missing, those many cases.
All right, thank you, that's enough.
Any other discussion? Seeing none, all those in favor signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 12-20, amend resolution.
Moved by legislator Michike, second by legislator Ansello, or Ansello. Thank you. Any discussion on this? Legislator Boyce.
Madam Chair, a few questions with regards to this referral. Through the chair, if I could ask the administration, why do we have this program that pays for, why do we have a program that pays for this and as opposed to someone's insurance paying for it?
Through the chair, this particular program primarily targets those who are, many of the resources are used to target those who are uninsured.
Through the chair as a follow-up, so if somebody were underinsured or not insured at all, that's the population. How about Medicaid? Would Medicaid pay for this?
Through the chair, typically what would happen is a individual's, insurance would be contacted first to see if they would actually provide coverage, for the post-exposure treatment. On the other hand, because of the seriousness of the disease, it's something that has huge, public health implications, and so the county takes on that cost.
Okay, thank you.
Any other discussion? Legislator Cayley.
Thank you, Madam Chair. And a comment and I think a question that will follow. I actually have a very close friend who was a recipient of rabies vaccination, not rabies vaccination, but rabies treatment last fall. And it is a very quick thing, and it turned out that it wasn't a rabid bat, but his statistics are actually in statistics that I took offline today. So that was good to see, because I think that the numbers that are showing in the New York State, the seriousness of this particular issue, even though the numbers seem low on a monthly basis, it's you either get it tested soon or you don't have anywhere to go with it. So it's good to see very current data on rabies cases. The other question that I had was, is this amount that's being accepted a reimbursement of previous services, or is this to cover services forward? I'm seeing a nod through the chair.
Through the chair, that is correct.
Thank you. That's it.
That's it. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-21,
Moved by
amend.
legislator Ansello and second by legislator Quattro. Any discussion? Legislator Andrews.
Madam Chair, through you to the administration, do we have any current Department of Health employees who work on the Immunization Action Plan program?
Andy Doniger, Director of the County Health Department. Yes, some of the employees in the Immunization Action Plan program are county employees, but some of them are contract employees. The way our immunization clinic works is that we have a lot of people that come all at once when we're open, and to staff up rather than having many full-time employees, we contract for services with the University of Rochester, and they provide us those nurses on an hourly basis. So we do have some that are our employees and some that are contract employees.
Thank you. Through the chair, so this contract with Ms. Kerlock, is she a nurse? Is she to do the work you just described, or is she to work on consulting services for this plan?
Through you, Madam Chair, she is a nurse. She is worked for us formerly in another part of the health department. We have been without a supervisor in that particular program for several months. We've been recruiting, and she agreed to fill in for us, and we're very fortunate that we have an experienced person that can do that.
Through the chair, then the plan would be that once a permanent person is hired, her services would no longer be needed. Is that accurate?
Through you, Madam Chair, yes, that's correct.
And through the chair, then what's your timeline for finding a permanent replacement?
We're very hopeful that we'll find someone very shortly.
Great, thank you.
Any other discussion? Seeing none. All those in favor signify by saying aye. Any opposed? Item carries. Next item, clerk.
Referral 12-22,
Moved by Legislator Boyce, second by Legislator Quattro. Any discussion on this? Legislator Lightfoot.
Madam Chairman, I just would like to know, through you, Madam Chairman, to the administration, quite naturally, when I see the word targeted, it sends up some questions, and I'm just asking, through you, Madam Chairman, to the administration, what are the targeted neighborhoods? Have they been identified? Through you, Madam Chairman, to the administration.
Through the chair, when we refer to targeted, that refers to specific zip codes, and in this case, the zip codes are 14609, 14611, and 14621.
Okay, 21, yes. Thank you, and to you, Madam Chairman, I'm finding that that's very in line with what was deemed the Crescent area, if you will. See that, through you, Madam Chair, to the administration, we're still finding that these same areas, 14609, I'm actually shocked that we don't see 08 in there as well, because I know that's adjacent to 11, and 09 and 21 seem to carry that larger east side area, and normally when we see these zip codes being presented in this form, especially with dealing with these targeted neighborhoods, normally we see 14608. Is there a reason why, or are we not seeing these things in the same targeted neighborhood as 14608, as well as these other three? To you, Madam Chairman, to the administration.
Through you, Madam Chair, there's I guess an algorithm or a formula that the State Health Department has recommended that we use, and if you fill in the blanks, it pulled out these three zip codes. I can't tell you exactly why 08 didn't come up as well, but there must be some difference in issues like the age of the property, the number of housing complaints, and sanitation problems that are reported to the Health Department. Those are all the things that cause us to target those neighborhoods under the Healthy Neighborhoods Program.
Okay. Now, thank you. Through you, Madam Chairman, to the administration, the particular language in this is talking about in-home outreach. So I guess I'm just inclined to want to know a little more about what's actually going to be done in the home as a result of this program. Through you, Madam Chairman, to the administration.
Through you, Madam Chair, there's an educational component, and then there are some activities that are in addition to the educational component. Obviously, there's a brief inspection of the property to see if there are any hazards that are apparent, if it looks like the ceiling is falling down, or are there any obvious exposed electrical wires. There's an assessment done to see if there's any peeling paint. We provide smoke detectors and batteries, also provide things like switch electrical outlet covers if there are children there. So a variety of different inexpensive items that we provide, although the smoke detectors are a more expensive item. But we find that many of these properties don't have smoke detectors.
So to you, Madam Chairman, to the administration, I'm excited about the program. I think it's great what's going on. I'm looking at, as far as funding and cost, looking at how we can help collaborate, not also reinvent the wheel, or if there's any room for collaboration here. These zip codes, quite naturally, are in the city, and I do know that currently the City of Rochester Fire Department gives out free smoke detectors to people in their homes. So I'm wondering, are we duplicating services in any way, or is there any way of collaboration to save a buck, as they are expensive smoke detectors, and if they're limited supplies, are we collaborating with other agencies when we identify these problems in the home, like the falling paint as well? Because now we could potentially have lead problems in the home as well. So I just want to know, is there a collaborative effort going on here through you, Madam Chairman, to the administration?
Through you, Madam Chair, yes, we work with a number of different agencies with regard to these problems. We are obviously well aware that the Rochester Fire Department is also in the business of providing free smoke detectors. And I think that since that has been happening over the last few years, we've seen fewer properties that have needed new smoke detectors. But when we get in a property and there isn't one there, then whether or not it was because the family took it down or it's being used somewhere else, or whether it just was not ever placed there, maybe the fire department never got into that property, we would place the smoke detector in that particular property.
Okay. Through you, Madam Chairman, to the administration, this is my final question here. Are there any new jobs being created by this funding?
Through you, Madam Chair, this is additional funding of $11,963, and so we're sort of, a number of the referrals that you see this cycle are additional funding, and this is related to a state initiative to compensate human service agencies and municipalities that have these recurring grants that they get year after year, and we have increasing costs of retirement and health insurance. And in recognition of the increasing costs, the state government has created a program whereby we get some additional funding. I think it's about 3% of the grant that comes to us as an additional amount. It tends to come at the end of the year, and it enables us to bill off some of the costs that might have been charged to the county.
Okay. So there's no additional jobs or opportunities provided as a result, just additional funding to help you.
That's correct.
To do the program. Thank you, through you, Madam Chairman.
Any other questions? Legislator Boyce?
Through the chair to Dr. Doniger, if I could just follow up on some of Legislator Lightfoot's questions. With regards to collaboration, how much do you work with emergency housing within the organization of DHS with regards to the same properties?
Through you, Madam Chair, I'm sure there are certain circumstances where we work with emergency housing through DHS, but I think that we're usually involved in sort of more of a preventive approach. But there may be a connection, but I'm not aware of it.
If you could, through the chair, if you could look into that, I'd be curious as to, if we're actually the county's paying for housing for emergency housing purposes, and we're finding some of the things that you mentioned earlier, exposed electrical, ceilings falling down, things of that nature. When we're going out to do that outreach, I think that would be important information for us to have. With regards to that when we're paying the bills on housing. If I could do another follow-up question with regards to the factors that went into choosing the selected neighborhoods. I understand that by zip code, Legislator Lightfoot also mentioned the Crescent, which we know has been targeted or is a targeted area. Its recognition is a low poverty area. Is there any other factors that was contributing to that?
Through you, Madam Chair, there's a sort of a formula that the Healthy Neighborhood programs around the state use. The state funds this program, and they ask us to do it in a sort of uniform way, and they provide us with a formula. And I believe that some of the items in that refer to the age of the property, the number of housing complaints, the number of lead-poisoned children. Some of the indicators of environmental hazard are included in the formula, and that's how we select this. It isn't just a simple process of someone making an assessment about where they think the major health environmental problems are in the community.
Okay, thank you.
Legislator Kaley?
Thank you, Madam Chair. Through you to the administration, if I could ask, how many homes can this, in 1 year's time, can this particular program impact?
Through the chair, it amounts to about 600 families every year, and in addition to that, about maybe 3 to 4 months later, that's about an additional 150 follow-up visits.
Thank you.
Through the chair.
And through the chair, in this case, is there data of return visits to a residence where the family has been there for a period of time, where they've been in residence for, say, let me back up. The first question I'd like to ask is, through the chair, how many years has this program been in progress?
Through you, Madam Chair, this is the 8th year of the program.
Thank you. That is very good. Through the chair, if we were, and this is really for my knowledge, if you were going into a home with a visit and it could have been a previous address that had been visited before, is data kept as to how long a family has been in residence at a particular home or address?
Through you, Madam Chair, I don't believe that that data is pulled out separately in a database, for example. It may be that there are some notes made and the name of the family is mentioned, but there, at the time of the visit, there isn't generally the time to go back and review all of the information from many years ago. I mentioned that there are 3 zip codes, but there are obviously many neighborhoods within these zip codes, and we tend to move around within the zip codes. I think it was asked last time we visited this referral which neighborhood we were actually in at the time, and I believe the answer was near the public market. And we're now in the Upper Falls area, so we tend to move around, and I don't think it's too likely that we're revisiting too many homes over again. They're just, if you hear the number before of approximately 600 homes a year, there are a lot more, many thousands, obviously, of properties in those 3 zip codes, and in 8 years, we wouldn't be getting to all of them.
Thank you. And just one more. Through the chair, when you're, I guess I'm looking at outreach too, and I realize that you target the certain areas, but in any one of these neighborhoods, there are neighborhood associations that exist and outreach agencies that are not really connected with agency funding or government funding. And I guess I would suggest at some point, which may not be now, that outreach to the individual associations, as they are major spreaders of the word, they can actually connect you with many more people in not necessarily a face-to-face way, but definitely spreading the educational material along to the people that come, certainly at the market and any other area that you wanted to have an impact on. And so I would just suggest that going forward. And in closing, the other suggestion that I would have is, I think what we found with families that have intact smoke detectors in the ceiling, I'm not trying to be flip. Do you test the smoke detector when you're in the home?
Through you, Madam Chair, yes.
Okay. Because many of them don't have a battery in them, and so I was thinking a nice baggie full of 9 volts would be good. But thank you. I really do like this program. Thank you. That's it.
Any other discussion? Legislator.
This is gonna, Dr. Doniger, through the chair. Your outreach workers that do go into the homes, if there were concerns with regards to anything else going on in the home, such as possible CPS issues, would that be something they would report back to you on?
In other words, through you, Madam Chair, in other words, if they were to observe child abuse occurring?
Well, not necessarily not child abuse, but there might be neglect issues. There might be conditions in the home that might rise to the occasion of a CPS investigation.
I honestly don't know the answer to that, but we can check into it. Many of the homes that we go into, unfortunately, have very minimal furniture, and there isn't much food in the refrigerator, and it's hard to envision how a family could be making it in those circumstances. I can tell you it's not the main reason for the program.
I understand that, but we do work for the county, and we are mandated reporters, so I just, through the chair, I would just wonder if you could get further information with regards to that.
Through
Thank
you, Madam
you.
Chair, we'll check into that.
Thank you.
Thank you. Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed, item carries. Next item.
Referral 12-23, amend resolution.
Moved by Legislator Michike and second by Legislator Ansello. Any discussion on this? Seeing none, Legislator Lightfoot? We are.
Again, targeted community is showing up again. So I guess I just want a little information about the targeted community outreach and the targeted population. To you, Madam Chairman, to the administration.
Through you, Madam Chair, the Healthy Mom, Healthy Baby program is designed to coordinate the perinatal health services and home visiting services for high-risk, low-income pregnant women in our community. And those high-risk, low-income women, probably many of them reside in the same zip codes that we have been looking at in the past couple of referrals. We're not really going door to door in this program. We're mostly getting referrals from schools, from obstetrical offices, from community organizations, from teen centers, and that sort of thing. So there isn't a sort of a deliberate effort to define a geographic area. It just so happens, though, that most of the low-income, high-risk women do reside in the center city.
Thank you. And to you, Madam Chairman, to the administration, I guess my question, looking at the goal, because I see there's a goal here to increase the identification. So I guess that was where I was leading with my question as far as the population. I understand it is for women that are at risk when it comes to pregnancy. But I guess how is this identification goal through the schools or through the teen agencies? I know my particular doctor, Dr. Morehouse on Arnett, I know that they work alongside with with the county a lot in identifying through Embracing Options, identifying a lot of these high-risk teen pregnant moms. So I guess I'm just wondering, how does an organization get involved with the county to become one of these agencies that identify, or how does the county reach out to get agency schools? I mean, how is that administered? How is that done? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, a component of the various outreach programs that exist in the county health department, for example, involves going and checking in with the school nurses in the high schools, with the obstetrical offices that provide services in the city of Rochester, with some of the other community-based organizations, to make sure that they know that these services are available. So that is an important part of the program. I think the network of organizations that serve high-risk pregnant women in the city, the network is pretty knowledgeable about programs like the Nurse Family Partnership and another program we have at the health department called the Perinatal Home Visiting Program. But we do need to get out there and remind them about it from time to time.
Now, to you, Madam Chairman, to Mr. Doniger, I guess my question, how about the churches? I mean, I know that, it's like we don't hear enough of the impact that the churches can have, especially in these targeted neighborhoods and communities. You know, we hear about the schools, we hear about these other agencies that are knowledgeable, but I don't see a lot of outreach into the churches where, you know, I really feel they could be of a huge assistance in this increasing these identifications and enrolling people. So, I mean, is there any way we as a county could figure out a way as we go into these schools and as we go into some of these other agencies that we could broaden think outside the box a little bit and maybe enter into some of these African American Latino churches and get this information there as well?
Through you, Madam Chair, we are networked with some of the churches that have sort of after-school programs or teen cafes, and we do connect with them and make sure that they know about the services that are available through the health department. But I'll take that back as a suggestion to look into that again and see if there are some opportunities there that we haven't been taking advantage of.
And I would be willing to help in that area because I'm connected with that organizations, a lot of them too, especially in the Southwest area. So if any assistance I can be, I'd be willing to help in that area too. Thank you.
Any other discussion? Legislator Kaley.
I'm sorry, I don't mean to belabor this particular referral, but I did have a question, and through you, Madam Chair, to the administration. We are talking about targeted areas, I understand, and you are moving around in neighborhoods within those targeted areas. But do you take referrals of individual women that are from outside those areas?
Through you, Madam Chair, there are a number of different programs that are home visiting programs in the city of Rochester, and they have various different criteria that the funder sets out. And yes, we do take high-risk pregnant women in some of our programs from throughout Monroe County. Most commonly, though, we see pregnant women in the city of Rochester.
Thank you. But then if I understand correctly, that through the chair, no one is refused, I don't mean that they would really be refused, but would be getting, if they were in a different program, pretty much the same type of education and instruction, maybe not to the fullest of this one particular program, but they would be privy to a lot of good information for themselves as well as services?
There are multiple programs, and the goal is to try to match up the pregnant woman with the most appropriate program. Some of them are more intensive than others. Some of them involve visits every week. Some of them are much less intensive than that. So we sometimes are full, and we have to have a waiting list for a while, coordinate with other services in the community, and refer patients on if we have a waiting list. So that's the goal of this project here, is to coordinate the services better. Thank
you. Again, I just hold this program in high regard, and having just been to, with Legislator Draw, the last graduating ceremony of nurse family at St. Mary's, it was a great event. I would like to, at a later date, get together, if you've not already done this, and talk about translating brochures or information in some of the multiple languages for the refugee community that don't. Some do reside in these areas, but the majority are within 14613, 14615 of the Asian communities. And whereas it may not be an issue at this particular moment, I think going forward we will see some changes in behavior, and I'd like to just be a little bit proactive and move forward with doing some translation of materials. Thank you very much. That's it.
Okay. Any other legislative voice?
Yes, I just want to clarify here. I think that the word targeted areas is not appropriate on this referral. It talks about targeting community outreach and targeted population, not necessarily an area within the county of Monroe. Is that not correct, through the chair?
Through the chair, yes, that's correct.
Thank you.
Thank you. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-24, amend Resolution 291.
Moved by legislator Ansel, seconded by legislator Boyce. Any discussion on this? 24, legislator Lightfoot.
Through you, Madam Chairman, it's more questions. More, it seems like the longer you're here in the legislature, the better you get with understanding stuff. So I think that's a good thing that things begin to really make sense after a while. Through you, Madam Chairman, to the administration, what type of special health care needs must a child have to be eligible for this program?
Through you, Madam Chair, there are some programs that we run in the county health department, like the early intervention program and the preschool special ed program. There are many other programs in the community, though, that we refer to. This funding helps provide support to the programs that we run in the health department, and primarily, or an important part of the work that the staff do is to take referrals and help direct people to the right agency to provide assistance to their child. Most of the problems that we're dealing with are in the category of what I would call developmental disability. For children that really have physical medical problems, those are usually handled through the more traditional medical care system.
Okay, thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 12-25, acceptance of a grant from the New York State Department.
Moved by legislator Michike, seconded by legislator Quattro. Any discussion? Seeing none, all those in favor signify by saying aye. Any nays? Item carries. Next item.
Referral 12-26, acceptance of a grant from the Oswego.
Legislator Quattro, second by legislator Boyce. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, referral indicates this is the 18th year we've received this grant, but I don't know anything really about oxygenation projects. So is that something that we complete every year, or is that a process that takes more than a year to complete?
Through you, Madam Chair, the Health Department works with our Department of Environmental Services in monitoring the condition of Irondequoit Bay. And historically, that bay has been not in good shape. Historically, it has become overgrown with algae and can almost be like pea soup, especially in the northern end. A number of projects have occurred on Irondequoit Bay to try to keep the quality of the water high. One of the projects that we have is called the Irondequoit Bay Oxygenation Program, and we basically we pump oxygen into the bottom of the bay in 4 locations on either side of the Route 104 bridge, and we do that starting in July of every year and run through the end of August. And we believe that that keeps the bay healthier, makes it much more attractive to aquatic life, which helps feed on the algae and keeps the water quality better than it would be otherwise.
Thank you. And through the chair, when was the last time that we've done a dolomite treatment of the bay?
Through you, Madam Chair, I think that's sometimes referred to as alum treatment.
Could be.
I believe that's how I know it. I believe that was done about 25 years ago. At the time, it was felt that that was an effective method for basically locking the pollutants into the bottom of the bay so they wouldn't come up to the surface and affect the water quality. But the current thinking by scientists in the Department of Environmental Conservation is that alum spreading on these kinds of bodies of water is not as effective as was previously thought.
Thank you. So that's not, through the chair, so that's not something that we would undertake again then at this point?
I don't believe so, no. It's not certainly it's not on our radar screen right now.
Okay. Last question for me. The referral indicates that the sponsor organization has changed in terms of grant administration to the Oswego County Soil and Water Conservation District. Do we anticipate any disruption in the project given that someone else will be administering the grant, or is there a reason why it changed from the Finger Lakes Association?
Through you, Madam Chair, I don't know the reason that it changed, but basically they are just acting as a pass-through for the funding.
Is there any reason why our own Soil and Water Conservation District wouldn't act as the pass-through?
I don't know how the New York State Department of Health and the Finger Lakes Lake Ontario Watershed Protection Alliance came to the conclusion that the Oswego Soil and Water Conservation District was the right agency to funnel the money through to all of the counties that receive the money. I just don't know enough about the details of that.
Okay, if it's just possible between now and full edge to find out a little bit. I know we do have the Monroe County Soil and Water Conservation District, so I just wondered why they wouldn't be doing it. But it's not incredibly important, but if there's by chance a quick way to find out, that'd be great. Thank you.
Any other discussion? Legislator Cayley?
Thank you, Madam Chair, and through you to the administration. You don't have to really fully answer it now, but if I could just get a paragraph or two of why Irondequoit Bay is in the condition that it is. I would venture to say it's a heavily trafficked bay, and with recreation vehicles, boating vehicles, boats, which would cause an issue, and whether or not runoff from the various small creeks and what have you that run into it, and even so far as to say septic systems, if those are part and parcel, if I could just get that either verified or
Through you, Madam Chair, I'm sorry.
at a later date. I mean,
Very briefly, Irondequoit Bay really was the discharge point for all of the small wastewater treatment programs that served the city of Rochester for probably 100 years before the modern era of sewage treatment occurred. And as a result, the bottom of Irondequoit Bay is covered with a lot of material that was basically waste material.
Okay.
And so that is one of the main reasons. And the other has to do with the fact that the Irondequoit Bay is the Irondequoit Creek is quite a huge source of water that comes in. It contains a lot of phosphorus and other kinds of runoff from farm fields in the upper part of that watershed. And that contributes to the condition of the bay that makes it very friendly to the growth of algae.
thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-27, acceptance.
Moved by Legislator Boyd, second by Legislator Michike. Any discussion? Legislator Andrews.
Thank you, Madam Chair. Through you to the administration, is this a new program entirely or just a new funding source for an existing program that we've already been doing?
Through you, Madam Chair, this is a new program to us. It's just getting started now.
Thank you. And since it is new, could you describe it a little more detail than what's provided here? The subject line indicates it's going to be directed towards communities of color, but it doesn't quite describe how that's going to happen. Thank you.
Through the chair, this is a program that will look at a couple of things, including STDs, HIV, and hepatitis C. And in that instance, in terms of focusing on communities of color, oftentimes that's based upon communities and in areas where we know that the rates are actually higher, just based upon county data that we have and sub-county data that we collect routinely through the county. And in terms of some of the programming that will be involved, that would include, I guess, specific testing. That would include counseling. That would include linkage to care. Linkage to care not only gets with some of our services, but linkage to care where appropriate, for other, I guess, services in the community.
Thank you. So is this more of a treatment-based treatment, or is it prevention as well, or how would you describe it?
It's both treatment as well as prevention, through the chair.
Thank you. So where physically, what do you expect to do exactly?
Through the chair.
Through the chair.
Through the chair, some of those efforts will specifically include outreach, to different communities, using some of our infrastructure that we have already in place. So, for example, we have, contact investigators that already work, from Monroe County Department of Public Health. And so to that extent, the resources that we get through this grant will allow those resources to be expanded to cover the wider scope.
Thank you. And so have you already identified the particular areas using the data you referred to through the chair?
We do have, I guess, maybe some of those areas already identified just through where we know from our own data where the high-risk populations are located.
And through the chair, then what are they, or where are they?
Through the chair, we can provide that to you.
Great, thank you. Is there also a reason that this would specifically target heterosexual individuals and not heterosexual and homosexual individuals?
Through the chair, that's mainly because with this particular grant from New York State Department of Health, they had several different, if you will, maybe core areas. And for some of the other areas, including homosexual subpopulations, there were other, I guess, entities that were applying for funding in those areas. So in this case, focusing on heterosexual or maybe population, we figured that was a better match for an unmet need. Through the chair.
I'm sorry, I didn't understand fully. An unmet need, is that what you said, through the chair?
That is correct.
Okay, thank you. Well, I'm excited to see that the county's receiving this funding and starting this program. I look forward to hearing about it as we continue with it. Thank you.
Legislator Boyce, did you hear?
Chair, through the chair to either Dr. Doniger or, I apologize, I didn't catch your full name, sir, our new deputy director.
Through the chair, Byron Kennedy, Dr. Byron Kennedy.
Okay, nice to meet you, sir. Congratulations on your appointment.
Thank you.
Question I had for either of you, how long does hepatitis C, could it be dormant in an individual?
Through the chair, that can, it's variable, so that can occur for years, even decades, before it's actually diagnosed. And through the chair, that's also one of the reasons why that's become a more of a focus, not only through the CDC, but also New York State Department of Health, in terms of having, increased efforts to identify those who are undiagnosed with hepatitis C.
Okay, thank you.
Legislator Lightfoot, I think you were first. Yep.
To you, Madam Chairman, quite naturally, I'm excited to see this. I've been working, after seeing the numbers that came out, I think it was a couple of years ago, of the most of our cases were, of new cases of STD were in African American teens. We saw the increase there. As a result of that, Madam Chairman and administration, what we begin to do at our Cut the Violence events, we begin to work with AIDS Rochester, and we begin to use our locations as sites for testing and for prevention information. It's been very effective, and I'm encouraging the administration in the county as we explore the use of churches for prenatal information, that we can also take a proactive thing here with this new program to as I open up that dialogue there, to share this information as well with the churches, but also utilizing the existing businesses and barbershops, beauticians. Those are very effective places for getting out this information to this particular targeted community. We've seen it work in the past, and I would recommend that, like I said, if it's not broke, don't fix it. So this is something that works. Those are areas that work, and if the county is looking for places to go to set up partnerships with, AIDS Rochester is doing a wonderful job in the community, in this community, have been doing it. I'm sure they would love to have some more assistance in these shops, these barbershops and beauticians in the area. No one's more connected to this community than those individuals. So I would like to recommend that we look to explore these churches and these businesses as well. To you, Madam Chairman, to the administration.
Legislator Cayley.
Thank you. Just quickly, again, this is exciting to have something get underway. Through you to the chair, to the administration, there will be no new positions funded with this, if I'm understanding the verbiage here, that it would be existing positions that are already just funded for, or would they actually have a person in them now?
Through you, Madam Chair, there are 3 contracts that total about $125,000. About $75,000 will come to the Monroe County Health Department. About $63,000 will be used for staff, and about $12,000 will be used for supplies. That's sort of how the budget comes out. And this will allow us to reduce the county cost for some of these services, but I don't believe there will be any new staff.
Thank you. So then it won't be overextending existing positions. In other words, it's going to be appropriate through the chair that this can be just blended into an existing job?
Through you, Madam Chair, we're working on that right now.
Thank you. And the other short question through the chair, it always is troublesome when we see only one responder to a request for proposal. And in both cases, the U of R, not that I have anything against the U of R or the ACM Medical Laboratory, that they were the sole responders for this. Would this be the case that we don't have that many agencies within our area that are capable, or that other agencies that might be capable just don't take you up on this? Through the chair.
Through you, Madam Chair, I'm looking at the language that you're referring to. Which paragraph are we in?
Right before the specific legislative actions required are the two sentences above that through the chair refer to both entities as being sole responders to the request.
These, through you, Madam Chair, these are these are RFPs that we do every 5 years. And so we didn't reissue these RFPs related to this particular program. I believe we issued the RFP for ACM Medical Labs last year, and for the University of Rochester to run our STD program the year before that. And for some reason, in those two situations, they were the only respondents. We were quite surprised.
Thank you.
Any other discussion? Legislator Andrews.
Yes, just quickly, thank you. Through you to the doctors. I believe, Dr. Doniger, you just stated there's $75,000 that stays with the county and then $125,000 for 3 contracts. I'm just curious. I just wanted to track that myself in the referral, because I see the contract for $35,000 and the contract for $25,000, but I don't see another one to make up the difference.
University of Rochester, $35,000, ACM Medical Laboratory, $25,000, AIDS Care Center, AC Center doing business as AIDS Care in the amount of $65,000.
I don't see that one in the copy that I have. Is it?
That's actually one that one is nothing to turn the one for AIDS care. Pardon me, one's for AIDS care. The only ones that actually been
Oh, we haven't. Through you, Madam Chair, my mistake. We haven't. There's a third contract that we would like to have as part of this program for mobile testing services, and the request for proposals has gone out, and the responses have come back in, but we haven't made the selection yet. I think it is likely to be AIDS care.
Thanks. Through the chair, then technically, will we need to amend this at full legislature? Do you expect to have it completed by then, or is it all right that it's just not designated at this point in time?
I don't believe we'll have it designated by the time that the full legislature meets, and we'll have to have another referral related to this.
Okay. So, but this one can go through as is for this point in time. Is that correct?
Madam Chair, that's correct. The additional funding for that third contract would be held until the third contract is approved by the legislature.
Thank you very much.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 12-28, acceptance of funds and authorization.
Moved by Legislator Quatro, second by Legislator Boyce. Any discussion on this? Legislator Boyce.
Through the chair, I'll wait for Ms. Crossdale. Through the chair to Ms. Crossdale, I see on a number of these that Catholic Family Center is involved with the on the contract as contracted agency, and I see Ms. Portanova's name on them. I understand that she has left their agency. Can you tell me who's replaced her and how, if anything has to be done with these contracts with regards to that?
Corinda Crosdale, Director of Office for the Aging. Through the chair, during the time the referrals were written, Ms. Portnova was still in her position. I have met the new director. Unfortunately, I cannot remember his name. I can get that information to the legislative body, and I don't believe that it's going to have an impact
Okay.
on the referral.
Okay. Through the chair, I noticed there are a number of our townships, suburban townships, that are included in this, and I see there's a few that might be missing. Are those going to be done in the coming months with regards to that, or are these all that are included at this time, or will there be more, I guess, would be a question through the chair.
Through the chair, the ones that are listed there are sponsoring agency or sponsoring municipalities for the nutrition programs.
Okay.
Those are the only municipalities that are sponsoring those programs at this time.
Okay.
Any other discussion? Legislator Kaley? I'm sorry, Legislator Boyce, were you done? I'm sorry, Legislator Kaley.
Thank you, Madam Chair. Through you to the administration. If I'm on 28. Okay.
Yes,
It's a big packet this month. I just wanted to ask, this represents a decrease of over $200,000 from last year's adopted funding. I just wanted to understand that, is there a total amount that this is drawing down on, or is this truly a decrease of what you had hoped to receive versus what you received?
Through the chair, that's a real decrease. The vast majority of that decrease in funding came from our elder abuse program, which is a statewide initiative.
And then, thank you, and through the chair, then could you address what this decrease is how it's going to affect your services?
Through the chair, those services are contracted out to Lifespan. It did affect their staffing levels. The program, however, is still in effect.
Thank you, but then through the chair, even if staffing levels are affected, then my final question would be the warm bodies that are affected by the decrease. Do you find that there's going to be a percentage of people that are not covered through this funding?
Through the chair, that program is a partnership with various agencies. I do not see a decrease in individuals being served. We work through Adult Protective Services, the Elder Source Program. We work with the Attorney General's office and various police departments to keep seniors safe and protected from elder abuse. So even with that decrease in staffing, we do have other agencies to assist us with this program.
Well, thank you, and if that's the case, and that's what I truly hope is the case, you're doing a very good job. I would prefer that the funding would be restored, but in this year not. So I appreciate everything that you're doing. Thank you.
Any other discussion on this? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item, clerk.
Referral 12-29, acceptance of funding from the New York State.
Moved by Legislator Ansello, seconded by Legislator Quattro. Any discussion? Legislator Andrews, I'm sorry. Andrews?
Thank you, Madam Chair, and through you to the administration. Just quickly, since this is only the second year of this program, could you just report out briefly about the first year and how you thought it went? Thank you.
Through the chair, we think it went extraordinarily well. We came up with a number of new processes that actually, if you had a chance to review the POS forms, we actually had over double the number of agencies sign up to that program than what we anticipated. And we're moving full force ahead. We're getting ready to get into the evaluation stage of how we did the first year, and it'll be empirically evaluated using a logic model. So when we put in a third-year referral, the legislature should have that information.
Great. Thank you very much. I'm happy to hear that.
Legislator Boyce.
Through the chair to Ms. Crossdale, in the actual referral itself, it talks about family caregiver across the age and disability spectrum. Does this also income-driven as well?
Through the chair, no, this is services regardless of income. This, again, is a statewide initiative,
Okay.
and what we're creating is a caregiver database. So individuals across New York State, if they need information on caregiver services, they'll be able to tap into this database. So the more agencies we get into this database, the stronger it's going to be in regards to a referral source.
Okay, thank you. If you could give this figure, dollar figure, this is way out there, but through the chair, do we have any sense of what the cost savings of putting somebody in a respite care situation versus them going to a long-term care facility?
Through the chair, off the top of my head, I wouldn't be able to give you that
Okay.
figure, but if you would like me to research it, I can certainly do that.
That would be great, thank you. And then one further thing. With regard to the referral, it's a total amount of $75,000. We're giving $68,000, so there's the balance or the other funding. My math is probably not approximately about $10,000, but with regards to where's the balance on this particular?
A portion of that funding is going to go towards the evaluator, and the remaining amount is held with the county for administrative costs for our office.
Okay, thank you.
Any other discussion? Legislator Cayley.
Thank you, Madam Chair. Through you to the administration. In forming this network information for family caregivers, is as delicate as it could be, is there any value or weight given to agencies that are superior versus less than stellar? I realize that that's a difficult thing to do, but in reaching out for assistance when you're a family person, sometimes you want to have a sense that you're making the right pick if there are multiples in the area. So will this be addressed in this reporting system?
Through the chair, because this is a non-biased system, we would not be able to attach a rating system to the providers, and it's very subjective of what would be considered superior. For one individual, the services might have been stellar. For another individual, they may not have been satisfied.
Then thank you. Through the chair, is there anywhere that anyone could go to for an accounting of complaints, resolved complaints, somewhat like the Better Business Bureau, but with a little bit a vaguer, very opaque type of information that if a family member came to Lifespan or to this network that they might be referred to?
Through the chair, there's no system in the aging network that we would be able to refer to that would provide that type of information.
Thank you.
Any other discussion? All those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 12-30, acceptance of funding from the New York State
Moved
Office.
by Legislator Michie and second by Legislator Ansello. Is there any discussion on this? Seeing none? Oh, I'm sorry. Legislator
As I said, Madam Chair, this is a big packet.
Cayley, yes.
Am I correct through the chair that this is a decrease in funding? Yes, it is. A decrease of $12,000 from last year's previous allocation. Again, does that affect the number of individuals served or the overall performance? Not in good performance versus bad, but the ability to cover as wide a swath as possible. How does this affect the performance?
Through the chair, you're correct. There is a decrease in funding, and actually the county absorbed the decrease, so there won't be any impact on the services provided to the community.
Thank you.
Any other discussion? Legislator Boyce.
At this time, through the, to the chair, I'm just going to declare my interest on this particular resolution. Thank you.
Thank you. Any other discussion? All those in favor signify by saying aye. Aye. Any nays? Item carries. Thank you. And I should say, before I go to old business, last Thursday, I know Legislator Cayley mentioned that we attended the Monroe County Nurse Family Partnership graduation ceremony, and I wish that Dr. Doniger was still here. I wanted to thank him along with Dr. Kennedy. They also were at the ceremony, and I just wanted to congratulate Monroe County's the 37 outstanding young women and their children graduated from this program. I think Legislator Cayley would say that as a wonderful experience to go to. If you ever get a chance to go to one of the graduations, I would highly recommend it. And our great county executive. A quote from her was, "All eyes are on Monroe County with this, the NFP program that we have here, so we stand out and we lead by example." So I'm proud that we're a part of this. Special thanks to, I hope you extend it to, Chris, maybe extend it over to Bev Farrow, who runs that, the Monroe County Program Coordinator under the direction of Commissioner of Human Services, Kelly Reed. And thanks to the United Way and Children's Agenda and Visiting Nurse and all those people who support this program, because it's a wonderful program. I think as by seeing all the discussion on the referral we just had about the healthy family partnership, that it's a good thing for us, for the young women in this county. So I just wanted to mention that. If anybody else has any new old business they wanted to bring up. Unfinished business, I'm sorry. Legislator Lightfoot.
I was given a few calls by some constituents or people concerned that, and I wanted to ask you through Madam Chairman, through the administration, are there going to be cuts to the therapeutic foster care program? Or have there been? Or do we anticipate through you, Madam Chairman, to the administration?
Legislator Lightfoot, I don't think that applies to the unfinished business.
Okay.
It's a direct question.
All right. Okay, moving on. Go ahead, one second.
Madam Chair, I mean, it seems to be kind of an unfinished budget-related question, because if there were a cut in the budget to therapeutic foster care, and we've just heard about it since the passage of the budget, this would be our first opportunity to ask about it. So I do think that it is technically related to a matter that we discussed in December. To go through the Ways and Means Committee maybe, instead of going, would it be discussions for them, Brenda? Or written, maybe we'd have it through the administration could have would you like a written explanation?
I think it's just a very simple question, Madam Chairman. Are there cuts to the therapeutic foster care? Yes or no? I don't think it's that difficult.
Legislator Board.
Yes, I appreciate the question that you're at this point you're asking, but I think that the appropriate person to answer that would be Commissioner Kelly Reed, and she's not here this evening. So certainly,
Well, we've asked for her to come to our meeting, and she has yet to show up. So I don't know how. I don't want to put my faith in that. And I'm asking the administration, who has the information.
I think that Legislator Lightfoot, if you would like to send a letter through this committee,
Okay.
through the chair,
All right.
through the Human Services Committee, and I will send it
Okay,
along to the
we'll do that.
administration.
No problem. Thank you. Moving on. We have currently, I think this also falls in line with our existing contract or budget that we have. Basically, we've hired a new Veterans Director, and I'm just asking through you, Madam Chairman, if that new individual, I've worked with the other individual that was there previously, would at some point come to this committee and we are able to meet them and see where their direction is for our Monroe County Veterans Organization. Through you, Madam Chairman, to the administration. And also, speaking on that note, as of a couple of days ago, a lot of people, I think it was a couple of months ago, County Executive Maggie Brooks, along with some of the other members of the Veterans Group, initiated a thing called the Veterans ID Discount. I don't know if a lot of our legislators are aware of this, but I think it's great. It's on our Monroe County website. It allows opportunity for businesses. I'm a veteran, so I pay attention to a lot of these veteran issues. That it allows businesses to sign up their business to give discounts to our veterans in our community. So I just want to commend County Executive Maggie Brooks for that program. As of a couple of days ago, my business is signed up. I figure you lead by example, and we're having Military Mondays, half-price discounts for veterans, haircuts, and I would ask my colleagues to make sure that if they have businesses or know of businesses, that they would go on our website and ask their constituents to put that out there for our military men and women.
Thank you very much.
You're welcome.
Any other unfinished businesses for the Human Services Committee? Legislator Andrews.
Thank you, Madam Chair. Just a couple of follow-up questions. the night of the budget in December, we discussed at that point the new information regarding additional child care dollars funding that the county was anticipating we would receive. At that point, it wasn't, if I recall correctly, included in the budget because you were waiting for an official, I think it was transmittal letter from the state in terms of the actual amount. Could I just ask how that stands at this point in time, if you have any new information to convey to this committee?
Through the chair, Scott Adair, Director of Finance. At this point in time, we have received nothing from the state in writing, so we are still awaiting that allocation.
Thank you very much. My last question was just, is there anything that has changed regarding waiting times or applications for food stamps? We've received several complaints recently, and I know Commissioner Reed's not here, but perhaps this question could be posed to her through Mr. Helfer. In terms of any sort of change that would cause applicants to have to wait a much longer period of time before they're eligible to receive food stamps and other social services.
Madam Chair, I will check with the Commissioner and report back on that.
Thank you very much. I appreciate it. That's all.
Thank you. There being no other unfinished business, the January 24, 2012 meeting of the Human Services stands adjourned. The next meeting of the Human Services Committee will be Tuesday, February 28th at 6 p.m. Thank you and good evening.